Hello, my name is Saro, Armenian. I'm a deputy editor of JACC Cardio-oncology.
I'm Daniel Lenihan. I'm also a deputy editor of JACC Cardio-oncology. I'm at Washington University in St. Louis and excited to be here in Sao Paulo, Brazil for the Global Cardio-Oncology Summit that just started this morning. Saro, I was wondering, one of the biggest issues that we're talking about today, but also we've encountered in our practices is, what are the cardiovascular challenges in patients that undergo stem cell therapy?
Thanks, Dan. So, as you know, stem cell transplantation or bone marrow transplant, back when it first started in the 1970s and 80s, was really a last resort option for patients who were essentially incurable of their primary disease. Now, it's the mainstay for a lot of treatment of hematologic cancer, so more than 18,000 transplants are going to be performed annually. These patients are surviving longer, and as they survive into their 10, 20 years plus, there's a substantial burden of cardiovascular disease that's much greater than the primary cancer itself. A lot of this is driven by the therapies that they receive prior to transplant, the complications that develop during transplant, and then the modifiable risk factors that develop after the transplant. So treating them and addressing these issues is a complex, multidimensional issue. And Dan, for you, I know that one of the areas that you're going to be focusing on today is multiple myeloma and amyloidosis. Can you talk a little bit about what the potential issues are that are looming in the foreground?
Yes, well, it's certainly an exciting time to be a physician, treating these patients right now, because multiple myeloma and amyloidosis have both been considered incurable diseases. There have been a lot of exciting new therapies that have been approved recently, and so the efficacy of those treatments are really astounding. The one challenge or major challenge there is that most of these patients have a lot of cardiovascular disease at baseline when they start therapy, and then the treatment itself is associated with a significant amount of cardiovascular issues. So our biggest challenges really are to identify the highest risk patients and then apply good cardiovascular prevention strategies to those patients.
Thank you.
Thank you.